Okay, so my name's Donna Turnbull. I'm the Community Development Manager for Voluntary Action Camden, and I also manage Community Links, which is part of the Care Navigation and Social Prescribing Service in Camden. And the purpose of today is really about embedding green social prescribing in the Camden social prescribing landscape. Voluntary Action Camden are involved in a green social prescribing initiative in Camden and Islington, which you'll hear a bit more about in a minute. And the other part of our work is we've developed a Green Social Prescribing Directory. So we're going to be launching that today and showing you how to use it. So that's both for organisations who want to add their activities and for link workers who want to find fantastic green things to send people to. So I'm going to start off by giving an overview of the social prescribing landscape in Camden, and I apologise for those of you who see this presentation fairly often. It is the same thing, but I'll just do 2 slides. Then we're going to hear from the Green Social Prescribing and Parks for Health programmes, and then Alex is going to introduce the Green Social Prescribing Directory, and then we're going to have the really fun bit, which is hearing from Castlehaven and the Calthorpe about some of the green social prescribing type activities they're providing. And then it'll be like an open mic bit where other people will get an opportunity to talk about what they're doing. And I may pick on some people. I can see there are some lots of greenies in the list. So hopefully we'll hear from lots of people and you'll get a chance to ask questions and do a bit of networking. So without more ado, I'm going to attempt to share my screen and go for the interview overview. Right. Okay, can everyone see that? Yep. Yep. Okay, so social prescribing in Camden. So it's a growing landscape. Voluntary Action Camden work with Age UK Camden to deliver a care navigation and social prescribing service. We provide a single point of access into social prescribing, and we take referrals from all over the place, not just from GPs. The service is also part of developing social prescribing, really, and developing the landscape. So we're involved in the integrated care system development, and we're involved with working with voluntary sector organisations around developing their offer. We also have link workers. There are quite a few here, I think, in primary care networks who are seeing people face-to-face in GP practices. And then we have other social prescribing link workers emerging hospitals in other settings, increasingly probably voluntary sector settings, and Castlehaven Community Centre, we'll talk a bit about that later. And then there's some very specialised mental health social prescribing delivered by Mind in Camden with Candy and the Tavistock. So it is quite a big landscape. It appears complicated sometimes, but as long as residents get to where they need to go for the right support, then that shouldn't be a problem, I don't think. So the reach of our care navigation social prescribing service, this diagram hopefully is just helpful for people to see where things sit. So within our service and within social prescribing generally, we work from prevention right through to very complex needs where you have care navigators working directly with multidisciplinary teams and different NHS services. Link workers in primary care networks sort of cross the 2 sort of worlds from prevention into complex needs. So hopefully all bases are covered there, from health prevention through to management of complex health needs. Referrals, you can see down this side, they're coming from self-referrals, the voluntary sector in some cases, through to all the big services like adult social care services, obviously the GPs, but a lot of the services in the health trusts, NHS trusts. And the places where people end up, they end up in all sorts of social activities, different types of community-based support, through to things like housing and care support, and also other NHS services for people with more complex needs. So I'm skip through the other slides. You will be able to get hold of this presentation if you need to see the rest of it. And this is just a slide really about social prescribing and development and system building. If you don't already know, there's an integrated care system emerging across 5 boroughs. And that kind of starts at a neighbourhood level with all that fantastic networking and services and support for residents and activities that is going on in neighbourhoods, then sort of works through the boroughs right up to this sort of 5 borough system. So social prescribing is quite very much a part of that, and particularly for the voluntary and community sector. So it has a lot of impact on the sector, both in terms of delivering social prescribing activities, but also the pressure that it's putting on the sector. It's a growing area, and lots of different projects are emerging to test things out, and green social prescribing could be seen as one of those things. So that's what today is about. The Green Social Prescribing Initiative and embedding that in the social prescribing landscape in the borough. So I'm going to stop my screen sharing and swiftly hand you over to Parks for Health and Green Social Prescribing. If I can get out of here, stop share. There it is. Sorry about that. So I don't. Do you need to screen share, or do you want Ricky to share that for you, John and Gabby?
I've just tried to screen share actually, and I've just said it says host disabled participant screen sharing. So
I think Ricky, oh, you are a co-host now. That's fine.
Okay, if you don't mind, just it helps me to.
It's easier if you do it yourself, I think.
One presentation, one slide, I should say, to another. So hopefully you can see that okay, presentation okay. Just a few slides, 6 slides, so I will just go through this. So yes, just to introduce myself then, my name's John Thorne, and I'm the Partnership Manager for the Parks to Health projects, which is running in Camden and Islington councils. And now I'm trying to come on to the next slide and can't do it. Right. Sorry about this. I'm getting there. Right, so hopefully you can now see a new slide called Parks to Health Vision. And so Parks to Health, this is a National Lottery funded programme. We've got money from the National Lottery Heritage Fund and also DEFRA and also from the National Trust to deliver a programme to use our parks to improve people's health. And so what you can see here is that we have a vision which is to transform the parks and green spaces in Camden and Islington so that they become public health assets, increasing physical activity levels, improving mental health, increasing social cohesion, reducing social isolation and loneliness, and then contributing to reducing health inequalities. Our parks teams are the first in the country aiming to make health so central to its services. The project ends in May 2022, or my role in it does, and then it winds down in the weeks afterwards. And the anticipation is the plan is then the work that we're talking about now would then become the regular work of the teams in the 2 boroughs. I'm still having a problem with screen sharing. Donna, can you just confirm that you can actually see the screens I'm sharing? You should now have a screen, a slide that says unique offer of parks. Great.
I can see it.
Great. I'll assume everybody else can, if you can, Donna. It's not quite showing that at my end. But anyway, so what we really want to capitalise on is two things. First of all is the unique offer of parks, and second, the health benefits of parks. So first of all, about the unique offer of parks, the great thing about parks is a place to be in nature in the city, and they are free, which is not to be understated at all. They're numerous. There's over 50 in Camden. So that means all residents live near to a park. They're open long hours, be it from dawn to dusk, or maybe even longer than that. They offer something to see and do, to see trees, flowers, maybe activities going on there. There may be a playground there may be sports facilities there. There's a lot going on. They're a really enjoyable way to be outside. And I think this is particularly important when with a borough which has a high number of households that don't actually have access to a garden. So they're a really good place to meet, and indeed, obviously, that's what a lot of people do in parks. Overall, they're perceived as safe, which is good, and they've proved to be very popular in lockdown as activities are taking place outside where people have felt safer. And within these presentations, a few sort of images of Camden Park, such as Kilburn Grange. As you realise, this photograph was not taken recently, but yeah, just to introduce you to some parks in case you don't know them. And then talking about the health benefits of parks, well, parks or nature generally offers considerable health benefits. So if 2 hours a week contact with a park, be it one visit or more than one visit over the course of a week, cuts the risk of poor health by 45%, which is a pretty staggering statistic, I feel. More specifically, they contribute to reduce a 50% reduction in risk of heart disease, stroke, and type 2 diabetes. Now, these are some of the top killers in this country. So if it can help to reduce the risk of those, then that can only be a good thing. And access to good quality parks and green space is associated with better self-rated health and so on, lower BMI and increased longevity. So and also population of parks have access to park at 20% less at risk of physical activity. And physical activity, or physical inactivity, I should say, physical activity offers great opportunities to really cut the risk of various health conditions, such as the ones I've listed there. More specifically, I've just added a quote here. We did a pilot back in autumn 2020 now, and only lasted a few weeks because of the lockdown situation at that time. But you can see how, in this particular instance, and there are many other case studies and quotes I have like this, how actually being in a park has benefited somebody's well-being, their outlook on life, quite simply, just to try to bring to life these statistics here. So, what are the benefits of green social prescribing? Well, the most obvious thing is that it means more participant activities and indeed more users of parks, which and therefore hopefully they're getting those health benefits that I was describing earlier. And in particular, you can see there'll be improved health of people who take up a referral to an activity. And again, case studies, one I just showed you now, and others as well, show that parks do that. They do that in Camden. Obviously, this saves the NHS money. I sometimes say a prescription for nature is better than a prescription and cheaper than a prescription that you take to the chemist. But also it has the advantage that I think if you're running an activity and for which you're receiving referrals to it, social prescribing referrals to it, then that hopefully would give a strengthened case for funding for support for that activity. And indeed, the organisation that delivers it is going to increase your profile. It's going to show that what you're doing, it has direct health benefits, which can only be a good thing. And also, it helps us. It's a strengthened case for funding and support for park services, parks teams as well. So in the Parks to Health project, which has been running for over 2 years now, there's been extensive engagement with the health sector and a whole load of other people, VCS organisations, people within the councils and other organisations, indeed national organisations as well. And what we have found, or I have found, there's a really strong interest in green social prescribing work. People want to know about it. People want to link into it. As part of this work, Voluntary Action Camden has been commissioned to support the development of Green Social Prescribing in Camden. And although I can't see her, I'm going to try and embarrass Donna now and just say, actually, Donna's assistance and work on this has been absolutely invaluable to me and the project as a whole, which has been excellent. And then finally, just to talk about what we're actually doing. So, as I say, Voluntary Action Camden, ourselves and parks teams are working together to create a green social prescribing offer in Camden. And we're really keen to work with VCS organisations, both for recognition of current activities for green social prescribing and creation of new activities as well. I think my colleague Gabby will talk more about this in a moment. And then what we want to do, once we've got the green social prescribing in a place where it's ready to be promoted, which will be very soon, and obviously we'll come on to this I think later, then we really want to get this out to health professionals, and so that they know what's there, and so that they start to refer people to it, be that social prescribing linked workers or other health professionals as well. And in that promotion, and again, Gabby may talk more about this, we want to encourage people to actually refer to actually visit a park and see what's going on there and all the fantastic work that's going on there. And to show, does this work or not? Well, Voluntary Action Camden will be recording the number of referrals to parks, and for a sample number of referrals, we're finding out if health has improved. So we're keen to, does all this work? It's great for me to sit here and talk about theory, but obviously the proof is in the pudding. And so we're putting in place ways to find out if this is going to work in practice. So I'll just stop sharing there and I shall hand over to Gabby.
Hi there, I'm Gabby. So I work in Camden Parks team. I job share with a guy called Andrew Wright. And one of the things we do is manage a very small team of partnership officers. And the kind of idea of green space partnership officers was a kind of updated version of a park ranger, I guess, and has kind of evolved during the Parks for Health project. And from our side, Parks for Health in Camden Parks is just all about trying things and enabling local communities to do more in their parks. And obviously that links to green social prescribing, because the more activities we can get in our parks, the more referral opportunities there are. But I guess the key thing for us is that it's kind of driven by the community and more sustainable in that respect. But we're here to kind of help it evolve and get off the ground, really. So all about enabling, creating, supporting community relationships with the parks themselves. I think in the parks sector, we've traditionally worked with park friends groups, which are a fantastic asset, lobbying, fundraising opportunities. But we do also want to make new friends of parks, as it were, or new members and connections with parks, and that's part of this work. So I thought I'd just run through a few of things that we're trying, sort of framed by Parks for Health. But as John says, the thing is with Parks for Health as well, it has also, Parks for Health has happened within the pandemic. So we have noticed, a huge increase in users and different demands on the green spaces. So one of the things we enabled in several lockdowns was enabling community unlocking of parks, a couple of parks for very specific reasons. And I think the reason I mention it is the kind of methodology of that is really what we're all about, supporting people do risk assessments, bring things to the table of the management team of parks, seeing what's possible, what's not possible, caution, risks, benefits. So we have got that. We've got a group of volunteers opening Kilburn Grange Park very early in the morning because they wanted that during the lockdown. It was important to them to be able to use the park when it was quieter. And it's continued, and they're fantastic eyes and ears of the park. And we've had a couple of other examples of that. We've done a couple of things around outdoor gyms. So the outdoor gym equipment in several of our parks, and just really trying to animate them and do a welcome. So a sort of welcome drop-ins for these outdoor gyms. again, just to make sure that they're open to everybody and not just sort of fitness fanatics. So we worked in partnership with Age UK over a programme of drop-ins, welcoming people, and also making sure that we signposted participants to local activities in their area. There might be a support to them, looking at, you know, breaking down isolation and that kind of thing. And at the moment, we've got a trial going on in Somerstown with Arsenal, activating Polygon Road open space outdoor gym. So there's some trials. We had a really successful program of Bloomsbury Health Walks, which was an idea that came from the community. It's been delivered by Camden guides in a voluntary capacity. And again, our role was just bringing people to the table and helping with risk assessments. And yeah, especially during COVID times as well, making sure, you know, group sizes were appropriate and the measures were in place. And they've been brilliant, really well received, good link of sort of socialisation and a brisk health walk. So there's just about to be a new programme launched for that for the spring. We're trying to support some community-led projects. So it's a community food growing project in Kilburn. The commissioners of Russell Square, which are basically a community group composed, but also a statutory group composed of frontages that face the square, in collaboration with Friends of Russell Square, have just commissioned some chess tables for the park, which is a really nice, just a really nice addition, and we'll trial it. And I think our role in that will be ensuring we get some sort of games there, but also promoting it to local organisations. So I was suggesting we could offer dominoes and Mahjong and other games above and beyond chess. That might be really nice to give that push in that area. So just an example of just trying to think about things a bit differently. And yeah, one of the main things for me is the TCB offer. So Trust for Conservation volunteers, which run our Green Gym programme. And that's all about getting people out and about in our parks, doing some physical volunteering, but it's the health benefits that come along with it that are so important. And again, the socialisation. So that's a key thing to refer through Green Social Prescribing. And to complement that, what I'm looking at doing is getting the park friends groups who do some volunteering. So there's a couple of groups that have some regular volunteering going on in their parks, like Friends of Waterloo Park, Friends of Fortune Green and Brunswick Square. And what I want to do is try and support those groups to do an offer that can be prescribed to, because at the moment it's very much sort of word of mouth, posters in the park, really successful and really welcoming and professional volunteering going on. But it would just be nice to get it available for people to prescribe into. And again, our role will just be looking at risk assessments and all the rest of it that we need to work up to complete that offer. And I think that's about it from me. I just wanted to give a few examples, and I try and post, we have a little flyer that the partnership officers use when they're sort of visiting community centres or organisations that they're trying to talk to and make connections with, and I'll try and put that in the chat, but if not, we could maybe circulate with the minutes. But thank you, and happy to answer any questions.
Thanks, Gabby and John. Does anyone have any questions for either Gabby or John? Can I see all the hands? This is the challenge. No hands. Okay. Gabby, I'm going to put you on the spot here. Do you want to hear from voluntary sector organisations who are interested in developing some of their activities in parks and open spaces?
Yeah, absolutely.
Great.
The easiest, yeah, I'll put it in the chat, but we have an inbox that we could use for that.
That's great.
Yeah,
and also,
that'd be brilliant. Thank you.
I'm very happy to hear from people who want to do that and pass them on to parks. And also we quite possibly have evidence and stuff from our data that people could be looking at to use in proposals for new activities. So we're always very happy to share insights from social prescribing. on that level. And on the volunteer front, I think some of our volunteers are very excited about the Green Social Prescribing offer. And so if link workers have people who would like to go to an activity in a park and are a bit nervous about going there, we have volunteers who might be able to support them to, you know, their first day at an activity or something. I
don't know how to put my hand.
Okay, your real hand will do.
Polygon close to us, so I'd be very interested in hearing more about the development of Polygon. We've got a dedicated volunteer coordinator here who could send volunteers their way as well.
That sounds brilliant, Peter. I'm very happy to. I'll message you directly, shall I?
No.
Great.
Thank you.
Okay, is there anyone else with a hand up? No. Okay, so we're going to move swift. Oh, Diana.
Yeah, sorry, I'm also in Somerstown, Peter. That would be very helpful, because one of the things we want to do, especially with we're a local history group, just saying that so people who don't know me, and we've set up a little museum in Phoenix Road, and one of the things we wanted to develop was little outside walks. Yeah, I'll have a chat because there's a London Festival of Architecture coming up in June as well, so we were sort of going to develop a little program of lunchtime or after work walks. So yeah, it'd be good to know, Gabby, your experience of that as well, in seemingly similar to some areas you work with. Yeah.
Definitely. And John, I don't know if you're able to add, but we're looking at providing some support, aren't we, to groups that are wanting to put on walks or wellbeing walks. We've sort of done some research around it with a consultancy called Shared Assets. But that is one of the key ideas that comes out of that stream, isn't it, John?
Absolutely, thanks, Tabby. Yeah, Diana, that sounds great. With the concert engagement that we did for this project, for the Parks to Health project, 2 activities came up far more than anything else that people were interested in doing in them. One is gardening, which won't surprise you, and the other one is walking. So, so it'd be great to have more walks taking place. I know a lot of walks already take place, but great if you're talking about developing outside walks, then that'd be just the sort of thing which would be really good to see happening. Obviously, in a park or linking parks, and then if you then happy to accept referrals to that Green Social Prescribing referral, so that would be really good. That'd be great to see take place.
Yeah, one of our colleagues, Siobhan, is training up to be a Camden tour guide, with the idea that we can then offer regular walks. And she did one for North London Cares. I don't know if they're here, which went really well actually. And then we ended up getting about 20 people turn up to our very small premises.
Well, that's great, Diana. If I may just add, I mean, and Gabby can talk more about this, but Gabby had mentioned about doing some walks, or about to restart some walks in Bloomsbury walks in Bloomsbury Squares, and that was done partly with the local association, but partly done with Camden guides as well. So already they're doing walks which are part of the programme of what we're seeking to do. But yeah, that would be a really good thing to see take place.
I would just say that Architecture Festival theme is social justice this year.
Right.
ACT, and obviously Somerstown has a rich history of radicals and social reform.
Yes.
So we want to develop those kind of walks, and it's a good chance for us to sort of launch them maybe.
That sounds great. I went on a walk by Camden guides of Somerstown, so know very much about the rich history that you're talking about.
Yeah.
Okay, I've got, there's a quick question for Gabby, I think, in the chat, which is probably a helpful one to ask at this point. How do you feel about fitness companies using the park for outdoor training? Some parks charge for that, apparently.
Our kind of approach really for fitness trainers, and there's a parallel with sort of people using our parks for kind of outdoor learning or forest schools is that overall we concentrate on the benefits it brings to the individual. So we're not a borough that's aggressively licensing fitness trainers. Having said that we kind of have a threshold of number of participants, which is about 5 or 6. So if a fitness trainer, a yoga teacher, Tai Chi teacher, skateboard trainer wants to train a group of people, sort of around 5 or 6 people, then that's absolutely legitimate use of our parks, and it's not something that we look at charging. There are more organised organisations that would like to develop kind of boot camp style things. At the moment, our route for that is to go through our event service, and we do look to make a nominal charge for that, primarily just to administrate the kind of admin around it, in terms of, again, risk assessments and impact on the park. So sorry, I hope that doesn't I hope that doesn't come across as wishy-washy, but that's how we kind of play it, really. So in general, we encourage it up to a certain number of participants, but if it goes above that threshold, then we do refer it to our event service to manage.
Yeah, that's quite clear. I think that small groups are okay, and I think there's a comment from Christina in the chat about larger groups might intimidate inexperienced users, which I guess it depends on the park too, doesn't it? So
there's a really big thing around that, around kind of comms and the kind of images that are shared, and really, we want our parks to be really encouraging to a range of participants. And
so talk to parks before you dive in.
Anything's possible, but sometimes we just need to look at the kind of nuances of it. And we might suggest a different space or a different area or something like that.
Okay, right, thank you. I'm going to move swiftly on to Alex and our Green Social Prescribing Directory. If you haven't got your activities on this, do it, please.
Thanks, Donna. So my name's Alex. I'm the IT and Digital Manager at Voluntary Action Camden, and for the last few months we've been redesigning our online directory of community groups. So just before I introduce you to the Green Social Prescribing Directory, I'm just going to give a little bit of background as to how we got here, and I thought it might be a good idea just to share with you what our current directory looks like, really just to hopefully show off a little bit so you can see that it's hopefully a big improvement on the last. But obviously VOC, as the local infrastructure support organisation for charities and other voluntary sector groups in Camden, we're quite well positioned to have that connection into community activity, and part of our role has been around promoting services and activities of voluntary sector groups to make it easier for residents to connect with those services. The directory in its sort of current state is really just focused around broad services, but what we've been looking at as part of this sort of next iteration is how to make that more useful for groups, community groups, but also other stakeholders in the borough that are wanting to connect with those services. And so just to then bring you, can everybody see the screen? Is that a yes? I can't see. Yeah, okay.
Yes, we can see.
Yeah, so this is, I suppose, the opportunity. This is a soft launch of what the new directory looks like. And just to give a bit more background to it, we've got these 3 directories. So the blue one is really the general kind of activities and services. We've got a room hire directory as well. But the one that we want to show you today is the Green Social Prescribing Directory. It's been themed green in accordance with our branding, and what this means, it's a space basically specifically more around the sort of green and fitness based activities, and the idea there is to help residents connect with those activities, and also to have a bit more information for social prescribers or referrers in the borough that are just having a little bit more insight into what those activities actually entail before they refer residents to them. I should say that this is still on our development site, so it is live as such, but we do need to sort of launch that formally. But when you're filling in your records, hopefully, and getting your information onto this directory, it will all populate onto here nicely. And what we're hoping following this session, of course, is that we'll get some more entries in here. We've had a few early adopters of the directory already, so we can show you a little bit of you know, what it looks like and how it functions. So basically, every organisation that fills in one of our forms, their record will come up on here. If you're a resident or social prescriber or anybody really, you can type into the search bar something that you're looking for, and it will sort of bring up.
Yeah,
the
I was just
results.
chucking my headphones in. I'm just in a webinar. Is that okay?
Sorry, was that a question for me? No? Okay. So you can type into the search bar and it will bring up any of the listings that we've got that kind of meet with those search terms. You've also got this map over here so you can see where the groups are located. Interestingly, for VAC, we get a little bit of analytical insight from the terms that are being searched for in here. So it sort of gives us a bit of extra intelligence over what people might be looking for, which sort of helps with our analytics and data monitoring. And then over on this side, you've got some filters. So if you want to, you know, search by a specific activity, or if you want to search by whether the events are, the activities are free or paid, or what kind of level of fitness that you've got, or who that's really targeting, then all of these search filters can kind of help you narrow down those results a bit further. And then the broad kind of record is captured over here. But for social prescribers wanting a bit more information, you've got this kind of pop-up. And on the pop-up, you've got a lot more information about that particular activity, including things around how newcomers are welcomed and supported, and some other sort of considerations around policies, training and safeguarding as well, which we hope that should make it a bit easier for the referrers to have that insight before referring to the activity. So in a nutshell, that's kind of the directory. The way in which you get the information onto it is by filling out one of our forms. These forms are quite clever. So in updating your record for the Green Social Prescribing Directory, it will also update your record if you've got a listing on the main directory over here as well. But it's all quite straightforward, and we've had some help from the early adopters of the directory to sort of streamline the questions that we're asking. Obviously, on the back of today, what we would really like is for any of you that are running these activities to fill in the form. There's a couple of minor tweaks that are still needed up here. So we've got the form link available, but we'll provide that in the chat and by email if you need it afterwards as well. And I guess it's just an opportunity. You know, we'll formally launch the full directory in March, but if there are, you know, if you're filling things out or you're using the directory and you're noticing any little niggles, or you can suggest any improvements as you're using that, then obviously there's a small window just to come back to us so we can make any further changes and tweaks. But we have done a fair bit of user research and testing, so we're hoping it's kind of you know, helpful for what you're trying to do. And yeah, we'd love it if you could fill out the form so that we can get some more records on that. So Donna, I don't know if anyone's got any questions.
Yeah. I was just going to add to that, Alex. on the form, you can put more than one activity on one form. So you don't have to do a form for every single thing. So you could write generally into, it will take free text, I think the boxes. So it'll take, you don't just have to list everything on a single form. So that, I mean, there is quite a lot to fill in if you're going to fill in all the information about policies and things that might be relevant to social, some parts of social prescribing. So, you know, just so it's not quite so onerous, you can put lots of things on one form. Does anyone have any questions for Alex about that? Nope.
Oh, sorry. How do we access that at the moment, Alex? Sorry.
We'll give you the address that you saw is the address that it will be. It is a live database. It's more about us updating all of our links essentially, so that we're not referring you back to the old clunky directory. So I'll put the directory address in the chat and the form link as well. And Donna, you've got those anyway, so you can.
I will. Yes. We'll put it in our newsletter, and I will email it to all the link workers and care navigators in the borough that we, I think we've got a mapping of everyone's with their emails. So we'll send that out directly to you as well, the link to get onto the directory. Okay, so next we've had a little preview actually on the directory, Castlehaven. We're going to hear about Green Social Prescribing in action now. Right, where's Catherine and Alison?
Can you see me? Oh, hang on.
Do you need the screen, Catherine?
No. I will be sending something through. I'd also like to introduce Trisha, who's our CEO here. Hi, Castlehaven. Yes, good morning. And also in the group is Alison David, who's our social prescriber who works for Prince of Wales Surgery and is based here at Castlehaven Community Centre 3 days a week. And it's she's kind of joined, we're at very early stages of the Green Social Prescribing at Castlehaven, but I'm very excited about this. I used to work for another charity in Lambeth. So I'm the environmental project manager here, but I'm actually a trained social and therapeutic horticulture practitioner, and trained a few years ago and delivered a therapeutic garden project for a charity I used to work in Lambeth, and also in Croydon, where I run a friends group in Croydon, and will be delivering a therapeutic garden project for adults over 50 in Croydon on my days off from here. So got lots of experience and been fully aware about green social prescribing for the last 3 or 4 years, but really I think it's just particularly during COVID that it really has come to the fore. And you know, the way the parks were used from the beginning of the first lockdown, and for me, I'm very passionate, because to me actually gardening, horticulture, being close to nature and plants is one of the best ways to improve people's health and well-being, and that's physical, mental health, well-being, social interaction. And you know, we're finding lots of people now are still quite afraid of kind of just going back indoors, and it's just being outdoors, not due to meet new people and in a safe way. So like I said, so we're right at the beginning of our journey here. As you saw, I've entered one of our sessions on the directory already, and there will be more coming online as well. So we've got Castlehaven open space. We've also got a horticultural hub with a little greenhouse, and we've also recently under our umbrella is Elm Village Community Garden, which is at Barker Drive in Camden, and we'll be running an open day starting out in April and doing sessions there as well. But the way at the moment I work with Mind in Camden, who are referring people to our community volunteering sessions on a Wednesday. And so my Wednesday community garden sessions are open to the community. People can just come to help promote their own health and well-being. But we do have referrals as well. And I do have a form, and I'm asking on the form on the directory that I get contacted first, because it's very important for people who've got experience in mental ill health, that they have the opportunity to meet me first, get used to the space, They might have low, moderate depression or anxiety, and actually meeting new people can be quite stressful. So we try to make them feel welcome, and over the period of 2-3 weeks to get more used to us, and come to our sessions regularly. We're also going to be used as a stepping stone. For example, I've got a new volunteer who joined recently. He's just been finishing a year-long program with Thrive in Battersea Park. And Thrive is a national charity. It's a mental health charity using gardening and horticulture for wellbeing. It's if you want to find out about social and therapeutic horticulture, go to Thrive. And in Scotland, the organisation is called Trellis. But Thrive runs like a year-long programme, and at the end of that programme, people are normally encouraged to go on to the next stage. So we've got one volunteer who's coming from Thrive and he's joining our programme, and actually it's a nice stepping stone for him to go from having a year-long programme with Thrive and then coming to us and into general volunteering. And the projects that I delivered in the past as part of social prescription in Lambeth, that was the project I devised and piloted a programme, and that ran for 2 years. And it was exciting to have people who, they're being referred by doctors, or probably were on medication, but actually what they needed is to be supported in that way by meeting new people, being outdoors. And so like I said, so we've got one community volunteering already on the directory. More will be coming online. We've got a new health and wellbeing program starting in April, and Tricia can probably speak to you a bit about that, but it's very exciting that we can use the park. I'm also actually a Healthy Parks creator, so I was involved with Shared Assets, devising a guide. I'm not sure when that's going to become available, about social prescribing as well. I think that's becoming available soon. But I'm very excited to use the space to encourage people to come and use our open space, whether it's for community picnics, meetups, that sort of thing, just to promote health and well-being. Yes, I can't think what else to say. Do you want to speak first, or I can maybe get Alison? Do you want to talk about the Outsiders project as well? Or?
Hi everybody, I'm Tricia Richards. I'm the CEO here at Castlehaven. Like Kathy has just mentioned, we do a hell of a lot of stuff here. But on top of that, we've got a brand new project that will be starting in April, which is called Health Yourself. And that will be encompassing not only the green prescription part of the package, but also lots of other activities, all based around health, that will be happening within the building for people of 18 plus, as there has been a huge gap in that in the community sector, I suppose, for adults that possibly aren't working, unemployed, maybe they work from home, that just don't have access to community services through social prescriptions. So we've decided to offer sessions around, it could be heart disease, diabetes, it could just be a social meetup group, a historical storytelling, whatever it is. We're going to be opening up. It's a completely pilot project. We've got 12 months funding for it, but it's very exciting, and we hope that social prescribers locally will be sending more people our way, because we're open to activities. So do let us know if there's anything that you'd like us to put on. We can't promise we'll put everything on, but those things that that you've always wanted to do with people that are over 18, particularly around mental health and well-being, then do let us know. And we have, like many other community associations and organisations, we have a plethora of other things going on, things for older people, young people, after school activities, and we've also got a very strong LGBT community projects happening on Monday evenings, and we have a sports project at the moment for called Outsiders United, and that's for 18-year-olds plus LGBT backgrounds that can come and do sports completely for free here at Castle Haven, along with the outside project. I'm going to zip up, but I'll hand you back to Kathy.
Yeah. Thank you. Yeah, so I'm very excited actually at Castle Haven, being able to kind of start the Green Social Prescribing in Camden, and it's been great to work on the Healthy Parks project as well and be Healthy Parks Curator. So yes, anything that you'd like us to do, please let us know. And I don't know whether if Alison wants to speak a few words. So she's our social prescriber. So she actually used to work for Castle Haven as one member of staff previously, but now, like I said, she works for Prince of Wales Surgery, and she's only been in the role herself a couple of months. So we're both in this journey together and kind of working out how things are gonna go for the next few weeks and so on. So I don't know if Alison, do you want to say something?
Not really, Kathy, but thank you. Just want to say hello to everyone. But yeah, no, it's great to, as Kathy said, I'm just really recently involved, started at the GP surgery, Prince of Wales, and I'm also based here at Castle Haven. So already starting to link patients with some of what Kathy is doing and other things going on in the local area. So.
Just to say, I think next week we're hosting the social prescribers here at, 2 weeks time, sorry, at the social prescribers here. So if anybody, and I'll be meeting them as well, so if anyone wants to have a little walk around our space and our hub, I'm more than happy, if people want to contact me and to organise it. So yeah, it's all very exciting.
Can you put something about that in the chat so people could email you or find out exactly when that's happening, because I think we've got quite a few social prescribers here. Okay, before we go straight into questions, I'm going to ask Gavin to talk a bit about the CalThorpe, then we can do the discussion and questions all together. Gavin.
Hi. Yeah, sorry, my name isn't on the bottom of my section, but yeah. So I hope my sound is coming across okay. It was a bit iffy earlier on, Donna. Is it a bit better than it was? Can everybody hear me at least?
I'm great.
Brilliant.
Yeah, it's better.
Better, much better. Well, my name is Gavin, and I am the supported volunteering manager at the CalThorpe Community Garden. I've been here for quite a few years. Basically, what we offer very, very hands-on social gardening sessions for adults of all backgrounds. Basically, my specific role is really working and supporting adults with learning disabilities, other even learning disabilities, physical disabilities, people coping with mental health issues, is sort of what I'm there to try and engage with people from those backgrounds, adults from those backgrounds who are trying to get out of, into doing something more productive and active and improving their well-being, really. The gardening sessions are open to everybody, of course, but we don't differentiate. But my job is really to engage with other organizations, which we've been linked with many over the years. I've written quite a few down, and I won't name them all, but places like Thrive, for example, definitely we have worked at Thrive before. Thrive have referred some of their trainees who have been finishing courses with a view to getting them into a sort of a hands-on work placement scenario. So we have worked with Thrive in the past, and we've got like Mind in Camden is another one, Hillside Clubhouse, St Mungo's, Westminster Kingsway College, to name a few, really. So yeah, basically what we aim to do is we aim to support 25 adults per year into moving on to something else, or just basically improving their own situations through very informal gardening sessions. Like maybe an example might be someone's lonely, somebody just wants to get out, just wants to meet people, wants to get into some fresh air, learn a little bit about gardening. They might have a balcony, they might not know what to do with it, that sort of thing. And then so we can support that person into getting as much out of what we can offer as possible, really. So like I say, we have been here for quite a long time. The sessions are very informal, very hands-on. We encourage people to come to try and join in group activities. We run the group activities 3 days a week, but I think what was mentioned earlier on, basically not everybody might be comfortable about just being stuck straight in with a group of 6 people that they've never met before. So how we will do it is when the client comes to us with a view to maybe joining in some gardening sessions, I will sit with me and my colleagues, whoever happens to which department they're going to work in, will sort of have a chat with them, nice and friendly, informal meeting at the beginning, find out, you know, how do you feel about working with others? Would you rather just come along on a day when it's a bit more quiet? Maybe we can get used to the place for maybe a few weeks, and see how you feel about then joining in a session with some others. So it's purely up to the individuals, totally up to them. They're coming to us, we're there to support them. So there's no pressure on somebody being, right, we run a group session on Wednesday afternoon, that's when you need to come. So we're very, very flexible. I'm very flexible on people coming in on different times of the week, you know, so it's no problem there. So that's what we do. I mean, we do everything from growing plants from seed, plant production, which we then sell on to the public. We have the whole garden needs to be maintained, so the volunteers will get involved with learning all about seasonal maintenance of what we're going to do from month to month and why we're doing it and what's the reasons and that sort of thing. Also, we have a food growing side of things where we all it's like a communal food growing area with polytunnels, so volunteers will get involved with growing crops that can be used in our kitchen for cooking activities. Obviously they can take some home and they learn about growing stuff in a small space. We're in King's Cross, built up area, not very many gardens around here. Most people have window boxes and a little bit of a balcony. So the idea really is that people can come and learn more about if they've got something, what they could do in their own space, what we can instill into them while they come here that they can bring home and use it for their own, basically, enjoyment, whatever. Healthy eating side of things, we encourage people to grow their own stuff. We demonstrate that you don't need acres and acres of space to grow food for yourself. It can be done in various ingenious means and ways. So we hope that people do take that from us as well. And that's it, really. I mean, like I say, we've linked up with loads of different organisations over the years. Obviously, the last 2 years have been a bit strange. I think in 2021, I think out of the volunteers that have been coming to us which might have a disability, I think I worked with the same 7 from March right up until October before we got any new referrals, and then all of a sudden we're up to 24. So I'm guessing that because of the organizations we're working with, basically we've been in touch with them, but they haven't been able to send anybody our way. And I'm guessing that because face-to-face engagement with their clients has been a bit slow getting back to the levels it was, and I think a lot of vulnerable adults were quite reluctant to come back out again because of obviously the virus. So reluctancy to come out and travel and things like that might have been a factor in it. But like I say, we've now built our numbers up to almost to 24 over the last few months. So we are working with each of those people to gauge what they want to do and how far they want to go. And then what we do after about 2 months is we'll sit each person down, see what you said at the beginning, where and you're here now, do you think that you're in any way reaching where you'd like to be? And if not, why not? And how can I help you do it, basically? So it's a process. Obviously, adults with severe disabilities, we're not exactly going to get them straight out into a job. That's fair enough. So someone might come here because they just want to be here. They just want to get out of the house once a week and meet four or five people every week and learn stuff. So we're happy with that. So we will just help the person move on as far as we can help them move on. I've got volunteers who have been here for years, and basically I don't know if they're ever going to leave, which is fine. Fine with me. But what we would really like is to try and help support somebody to move into something that's maybe a bit further down the line. Maybe, move into doing a volunteer day somewhere else if they're up for it. If not, no pressure, then we're happy just to carry on and just support the people as best we can, really. I didn't do it. I'm not very good at doing presentations and stuff. I sort of just waffle on until I've run out of things that I've scribbled in my book. So that's basically where we are. That's the sort of thing we do. We run the sessions are very, very informal, hands-on, no pressure. I'm not on anybody's back because they haven't come for a couple of weeks, you know. So it's totally up to the individual, and we will adapt every activity to suit each person as best we can, really. So that's it, really. That's
okay, thank you. So that's two really great projects in Camden, and you can actually, if you're out and about at the Castlehaven Park or the Calthorpe Community Garden, you can actually just wander into these places and have a look. I went past Castlehaven last week and there are loads of people digging in the park. You know, so you can just wander in and have a chat if you want to know more about them. Does anyone have any questions for the Castlehaven team or Gavin? No. Can't see any yellow hands. Okay, so I'm going to...
Sorry, I can't find my hand. Can you hear me?
Yes.
Hi. Yeah. Question for Gavin. It sounds like a really interesting structure you've got, your work structure there. It's quite flexible. I'd like to come and chat with you about it. So
that's brilliant.
At some point. I'll find. Will you put your contact?
Yeah, I'll put my email in the chat now.
Thanks very much.
No problem.
Okay. Is there anybody? I noticed in the amongst the attendees, we've got London Plus and Natural England. I wonder if Laura or Stephanie would like to say anything about the Thriving Communities programme, and there's a Green Social Prescribing element in that. Do you mind being picked on?
Yeah, thank you. I'm happy to say something. I haven't really prepared any notes, but yeah, this has all been very exciting. I've just been having actually a little play with the new directory, which is fantastic. I love the fact that you can choose specific beneficiaries. That's really good. Yeah, so Thriving Communities is, and I am relatively new to this, so Stephanie can come in and correct anything I've got completely wrong, but it is a program run by the National Academy of Social Prescribing, and it's supporting small local organizations that are delivering all kinds of social prescribing, not just green social prescribing, or are interested in doing so. So to join the Thriving Communities Network is actually free, and you can do that via NASP's website. So I'm just going to have a quick look through my emails and see if I can find that direct link for you. But also, there is the Learning Together program, which has cohorts running, I think, a couple of times a year, and that's a series of webinars for learning, which is really useful. You do have to apply to join that separately. So if you keep an eye on NASP's website, you can see when the next cohort of that reopens. So I'm just going to pop that link in the chat, and it's where you can sign up to the network if you haven't already. And I definitely recommend that because you can get a lot of support and sort of guidance from that. Yes, and if you're wondering what Natural England has to do with it, we basically have, I think it's 6 or 7 regional health lead advisors who are working closely with NASP on the sort of Thriving Communities program. And what we are doing in particular is working to understand the provision of green social prescribing throughout London. So the directory is going to be really helpful for that. And also to support organizations, link them up with other organizations doing similar work in their area, and just trying to strengthen provision as well.
Okay, so
yeah, the only thing I'd add to that is that if you're involved in green social prescribing, the GLA is currently doing a big mapping exercise around green social prescribing across the whole of London. So, and there's also something called the Future Neighbourhoods programme, which some of you may be aware of, that's specifically based in Summertown. so those are the two other things and that's really looking at environment and green social prescribing as well. So I've contacted a couple of you that I was aware might come from Somerstown, just to sort of say I'll link you up with those people. But no, what Laura said, that's exactly right. That's what Thriving Communities is about. That's what the Learning Together program is about. And yeah, I think that's probably all I can think about in terms of, they're all, I mean, Parks for Health, I think you're here, but Hamidia is the person I've been in contact with, and I don't know whether Parks for Health, that's all linked in. I'm a bit confused about how it all works, but the GLA is also doing work around that as well. So for anyone who sort of wants to know a bit more about that, maybe contact me separately. I've put my details in the chat to let me know that you want me to link you up with either the Future Neighbourhoods programme, and obviously just to let the GLA know that you guys exist as well. And obviously I'm part of the network of Sustain too, so they've also got quite good links with Sustain in terms of green social prescribing. So I'm not sure if that helps.
Sorry, I'm having a dodgy moment there. Okay, thank you for that, Stephanie and Laura. Does anybody else want to tell us about what they're doing in this context? I notice we've got Heath hands, I think, and I can't see hands. No?
Morning, Donna. Yeah, I can. Morning, everybody. I'm Colin from Heath Hands. So I'm looking at my wrong screen. So
sorry, I can't see you all over.
Yeah, just to, for anybody that doesn't know Heath Hands, we're based up on Hampstead Heath, also Highgate Woods, Golders Hill Park. So we have quite an active volunteer group that's out conservation volunteering and gardening. What we're looking to do is develop some more therapeutic gardening spaces. So it's really great to hear from Gavin, and we know the great work that's been going on at Castlehaven as well. We are a little bit limited, and despite having 900 acres, we don't actually have much safe space, if that's a good way to put it. It's obviously public space. So what we're trying to do is actually create a bigger yard space at our main base down at Parliament Hill, just to be able to have a sort of enclosed garden, and then we can be a bit more active in terms of teaching. We have 2 work experience trainees who are on a sort of 8-week program, and we're recruiting actively a paid work experience as well. So what we've tried to do is, because we have a big volunteer group, but we're trying to give stepping stones into the sector, and so we're specifically focusing those placements on underrepresented groups, and that's, I think we've had 6 trainees that have gone on to various things. They've all gone in different directions, because one went to college, one was applying to university, and one was going into a completely different sector. So we've kind of identified that as quite an important step in the chain, because we can keep recruiting volunteers, but we want to give those stepping stones into work. And I'm just about to ping Gavin an email, because myself and a colleague are going to go out and look at some gardens, including the storytelling garden. And I know Camley Street's reopened, so we're actually going out for a bit of a recce to go and visit some places. I was Colthorpe, we were hoping to pop in and say hello on Thursday. But yeah, it's kind of, I think, a sort of question earlier on, and I know I probably missed the chance, but I think we're quite a wee bit, don't quite know where we're fitting in the social prescribing landscape. I think we've come to a lot of networking meetings, and obviously we're a host and we run lots of activities, but obviously we want to do more. But I know we're listed on the directory, but it's actually I don't know whether if the link workers want to have a conversation with us about what we can do, because we've got capacity, we've got a lot of green space, and also different volunteer roles, so public facing stuff, and also less public facing things if people want to just get involved in gardening. But also, you know, we're seeking funding as well, because obviously we find being volunteer led, a lot of our activities. It puts a bit of pressure on our volunteers who are, need training, need support from small staff team to be able to work with social referrals. So I thought, oh, that was a little bit of introduction to Heath Hands and Hampstead Heath. But yeah, probably pose a question as well.
Thanks, Colin. Yeah, you may not know if you get referrals sometimes, because some people don't want to be formally referred into things. There will be people who will just want to take the information and go themselves. It might just be that they're looking for something that's a bit social or a bit active. And volunteering, I think we've actually referred people to you in the past as volunteers. Volunteering is quite popular with people who are looking at just reconnecting with things, really. Christine, did you have Christina, you had your hand up?
Oh, sorry, I've put my hand down again now. I was just wondering how to, because I'm at Parliament Hill Medical Centre, I thought it'd be good to make a kind of connection with Colin, and so I was just wondering how to do that. And then I've realised it's Heath Hands, isn't it?
Yeah.
Yeah, as most things with the Heath, it's a little bit complicated. We referring to as Health Connections, and we're linking into the Keats group and the other group that practices, name escapes me, in Kentish Town. Obviously through our swimming facilities, our athletics, and there's lots of user groups on the Heath, Run Talk Run and Walk Talk Walk, and Camden has walks on health walks on a Monday morning here. So it is relatively complicated. But Paul Maskell, who some of you may or may not know, who's the leisure and events manager, so leading on that, and Heath Hands is supporting that. And just kind of, if anybody wants to give bowls a go, or volunteering a go, or wants to go swimming, possibly in a few months' time, rather than in February, then we can be that link to take people along and just introduce you to the lifeguards, for example, and just to how you access the facilities. And we can also offer free places as well. So there's quite a lot going on. I can put a link in the chat with the sort of the route in, but I think yeah, we're actively trying to work with more groups, and there's a lot going on, and our comms is quite poor in terms of what is going on where, because there's English Heritage as well up at Kenwood, so it's a little bit complicated, but I'll stop talking about that.
Thanks, Colin, and putting the link in the chat or your details would be really useful. I think, especially if you've got free swimming places, that's always, we work with a lot of people who are on low incomes and can't necessarily afford to go to swimming pools sometimes.
I'll quickly backtrack on that. We can, but if you read the Ham and High or the CNJ, swimming is one of the most controversial subjects for some reason for Hampstead Heath. So, but as social prescribing, we can facilitate that, but it's a bit political. So I will shut up.
I guess if link workers talk to you about that might be the route to do that. Okay, that's really worth knowing. Thank you. Diana, you've got your hand up.
Morning. Oh, sorry, it's probably a little bit out of date now, because it was that point you were saying about if people know they're being prescribed, it doesn't sort of work, because we were invited to something with an elderly man who we helped, and we kind of knew we helped, but he doesn't want to be thought of as someone in need of help. He came along because he was interested in history. He doesn't want to be sort of it's an odd one, isn't it? So I think there's just a sensitivity around, you're an old person, therefore you need help, you're lonely. And I think it's that thing with social prescribing that people won't come forward and say necessarily that I was helped by this, or that this, I was in need of help. They just find something themselves. But in effect, it is what you're saying, social prescribing, isn't it? But yeah, it's just a point, really.
On mute. Yeah, and it is a very good point, actually. It is quite sensitive, and I know our team, our community links team, often have those conversations with people when they've been referred by a GP and told that they need to socially connect or need social interaction. It's a terrible thing to be prescribed for. So, you know, it just doesn't sit well. And I think, you know, a lot of residents aren't really interested in the social prescribing strap line. It's actually what they get connected with, and that kind of medicalization isn't always helpful for people getting, you know, encouraging people to connect with stuff. Catherine, you've got your hand up.
Yeah, I just kind of really wanted to kind of reinforce that point, actually. I mean, I don't like quite the words prescription in this context either, but it's more about signposting or just letting somebody know, oh, there's these opportunities available. And actually with us, you know, people don't have to be referred. You know, people can just find out about us through the website and contact me and say they'd like to join our volunteering session. So it's that, you know, it's very informal, it's very sensitive. You know, everything's kept very confidential. So the people who come join my sessions on a Wednesday, you know, I get to know about them over the few weeks. But, you know, initially somebody can come and not say a word much at all. But over time, as they develop that trust and that kind of friendship and get, they start to open up. But yes, it's that, I hate that word referral. So it's about signposting, letting people know there are these opportunities there as well. Just kind of want to reinforce that. So yeah, it's just signposting. Yeah, definitely.
And I think, you know, link workers are usually very well trained around that and have a lot of kind of empathy around that sort of situation. So they do know how to talk to residents who are referred by their GPs, etc. So yeah, maintaining that sort of balance, really. Do we have any more questions? This strange thing. One day we'll all get back to a real room instead of looking at all these squares. So no more hands up. Okay, so I'm going to just wrap it up then. We can finish early. So just to remind you again to please update the Green Social Prescribing Directory. Get in touch if you are a voluntary sector organisation and you want to deliver some things in parks. Get in touch with Gabby, or you can get in touch with VAC and have a chat and we'll connect you up. And yeah, join Voluntary Action Camden. As I said at the beginning, social prescribing is part of a bigger developing integrated care system. And as that develops, we'll be looking more and more at the expertise in the sector and developing that voice for the voluntary and community sector. And VAX membership's going to be fairly key in that. So please join us. It doesn't cost anything. Yeah, join that membership list and you'll be on our sort of mailing lists for updates about that. And we will be trying to engage some of your expertise when those things start to happen, but there's more of that coming in the future. We'll do another of these on the integrated care system. Anything that anybody else has to say before we go? John?
Yeah, just to add to what you've just said there, Donna, it'd be great with organisations here which are delivering activities now or maybe in the future in our parks, if you're able to get onto the directory, because I think there's a fantastic opportunity here which benefits everyone. Everybody gains from this. So if you're able to engage with this, that'd be absolutely brilliant, and it would make I think it would just make a huge difference to organisations, but most important of all, to people's lives. And so I urge you to be a part of this, and it's great to see so many people here today. This shows a strong interest that there is in this. And just on a personal point, I would just like to thank Donna for organising such a good event.
Okay, thank you. And thank you to our presenters, all our presenters, and hearing about all your fantastic activities. And yeah, we'll keep up to date with that as things progress. So thank you and goodbye.